We lived in France, and I was playing soccer at a pretty high level for my age then. And then they said, well, you can't play anymore because, you know, you've had a heart surgery and it looks like you need a new valve. So we talked to a couple doctors in France, in Paris, Lyon, and things like this. And they said, well, there is a guy in America that's named Denton Cooley, who's dead now, who may be able to do something. So we went to Houston, we saw him and all that. And my parents actually moved to Houston for work. And so we went to see Denton Cooley, and he had, at the time, a guy who's dead now, Grady Holman, that was doing work without putting valves. And he opened it up with the risk that I would need a new valve later. But that was done when I was 14 in 1982. And now we're in 2018, and I'm 51, so it's lasted a long time. So I've been, you know, checking every year, but this year I came and they said it's a little bit enlarged, so it's better to put a valve. Do a few things.
Okay.
They're going to change the valve, one. Then they're going to do an arching... Amy arch.
Okay. And
change like the raising up of the aorta, and then do 2 bypass. Maybe just for fun. I don't know.
When did you start to notice that your valve was going bad? Or
I didn't notice.
You didn't notice?
I was fine, but I just do a checkup every year. And so I work for a school, right? And we serve the embassy kids in all the countries. So I worked in Morocco for the Embassy School of Morocco. And now I work in Vilnius, and because it's very close to Russia, we have lots of NATO kids and embassy kids. So I work over there, and every year I come here to recruit American teachers, because we have to have American teachers. And they have to be US certified and US citizens and all that stuff. So I come here, and in Boston, New York, there's fairs every year. Between the Boston Fair and the New York Fair, there's always usually 4 or 5 days that directors of schools like me used to go see their families or whatever. So I came here to Destin, and I usually do my checkup when I'm here. And so he saw me and he said, maybe we should do something. Even though you have nothing, it could be bad because the aneurysm of the aorta is closed. So he said, you can come back in June, but I wouldn't advise it. You can go back to Houston, but you know, it's a lot of things, and we were comfortable with Dr. Sandwith, so we said, let's go through with it. We knew some people in Nashville that is a doctor and that vouch, talked to Dr. Sandwith, and we said, okay, let's do it here.